Hello, welcome back. I am Dr. Diamond and this is adimeofot. And today we're going to be talking about what is pediatric occupational therapy. So many times when we talk about pediatric OT, we're talking about anyone under the age of 21. And even for some others, if it's a good fit, if it's for an outpatient clinic and it feels like it might be a good fit for a client that is older, then that can happen as well. So basically what we're looking at is how to maximize as much participation in any daily activity. So for a child, right, that would be play. Can they have as much engagement in play, whether by themselves, with others? Can we maximize how they're able to take care of themselves, learn to put on socks and shoes, put on their book bag to go to school, open their lunch containers, all these different types of things that a child can do from when they wake up until they go to sleep. So this can look like having more independence with an activity, or it can be, okay, let's find some tools and strategies that make it easier for it to be completed. So that's the different areas that we can look for when either a doctor or maybe a community resource reaches out and recommends occupational therapy. Another thing that people usually ask me is how often. So for therapy, this can range from once a week, it can be twice a week. For some kids, it can be twice a month. If you're in the school system, it depends on their individualized education plan. And so it really depends on the family. So there's not a right or wrong way, unless it's a blanket across the board. You have to get twice a week or you have to get once a week. When it's a blanket across the board, that's an issue. But if you have a lot going on, you have multiple kids, you have to get everyone to soccer practice and to kids go to different schools and things like that, then you can always ask and say, hey, can we change the time? Can we maybe do once a week during the summers and maybe do twice a week during the school year? You can ask for those things because it's for you, it's not for the therapist. Okay. Next, evaluation. So after a doctor recommends for occupational therapy, you'll typically get a call or text message from a clinic. It can be for a private clinic where it's just one therapist. It might be a larger facility where there's multiple therapists for occupational therapy, speech therapy, physical therapy, things like that. And what they'll do, things you should look out for, right? They'll probably ask you a ton of questions. A lot of questions you probably have said over and over again. So if you want to bring in some information so that they can read it instead of asking you a billion questions, you can do that. You can also ask if you can email it to your therapist. I always appreciate that, so I don't have to read it on the spot while I'm trying to observe the child. The next part would be observation. So I'm going to look at the child and see how they do with putting on their socks, how they do with writing their name if that's the stage that they're in, how they do with putting together a puzzle, looking at their fine motor skills, looking at how they interact with a swing or with a slide. Do they have any fears associated with their movement or how they process different textures that have to do with play? I'm looking at all those things. And the last thing would be we have standardized assessments, which are basically like we're looking for certain scores that can qualify a child, but that's not the end all be all. And the last part would be we can also use parent reports. So that's going to be all those questions, but they're written out. And sometimes we can't go off of what you said before. We need you to like write it out, or I'm going to fill out the parts that you've already talked about before, because it does ask certain questions like most likely, less likely, in the middle. And so I might go back and say, okay, when you ask me about their being able to fall asleep quickly, are they more likely to do it 50% of the time, or are they less likely to do it 25% of the time? I'll ask more questions about that. So a lot of questions, a lot of observations, a lot of just getting to know you, getting to know the family, getting to know the child. And this is also a good opportunity to see like what the therapist style is like, and asking them a lot of questions too. Like, just don't let it be like a one-sided conversation. Get to know them, their treatment style, if it fits your child's personality. Another thing to keep in mind, of course, is like how long you've been on a wait list, how long it took you to get to the evaluation, and if you want to take time to educate your therapist on your child's personality versus just like interviewing with another therapist. So keeping those things in mind too, because like I understand like having to wait 6 months and then you feel like figuring out it's not a good fit, and feeling like you have to start over. So if you feel like there's room to educate or give them a second chance, go for it. But if not, don't be afraid to fire your therapist. 2 more things you need to know about occupational therapy. Okay, so first, know that therapists can work in different settings and they have different ways on how they approach treatment. So, for example, I work in an outpatient clinic. I see 1 kid at a time for usually 55 minutes to an hour, depending on what's going on. Some kids I see for 30 minutes. Other therapists work in the NICU. They can work in what we call early intervention, which is in a community setting. So you're going to see the therapist come to your home, or they're going to come to the daycare where your child is. And then we also have school-based occupational therapy. And school-based occupational therapy is looking at what a child needs from an educational standpoint. And while a school-based OT and a outpatient OT like me can definitely overlap, they're looking at things from different perspectives because it's in 2 different settings. I'm in the clinic and they are in the school system, where they're looking at how a kid interacts in the classroom and what needs that they need to address for you and for the teacher. So it's a little bit different. The last thing is that it's, even though you can have twice a week, you can have once a week, it's not usually enough for a child. It takes a team effort. And so really think about those weekly sessions as check-ins, a chance to say what's going well. Maybe the homework or the strategies the therapist gave you the week before worked really well and you want some more ideas, or maybe it wasn't a great fit for your family or your lifestyle you feel like going on. Making sure there's a team effort. They shouldn't just be watching your child for an hour and then bringing them back with no information. They should be able to give you some things that went really well, maybe even if it's a strength, like, oh, they did really well with this kind of puzzle, or they really love being able to ask for help this way, being able to use an AAC, or being able to use utensils that have a really thick handle when they're eating. Even small strategies like that, like as long as there's some kind of check-in, that's going to make progress go even further. I got one more thing to say, is that progress is individualized, right? And so it's okay if things don't happen overnight. Sometimes things take time. I even sometimes compare it to going to the gym. Like, you're not always going to see immediate results. As long as you're seeing like small changes and small progress, as long as we're going upward, that's good. If we have plateaus, sometimes that's okay. It might be a good time to check in and say, what are some things that we can do different as a team? Or what are some community activities that we can do to support therapy? It might be a good thing to ask about those things. But overall, just know, like, there's nothing wrong with your child. This is a good time for just support for you and for them. And so just really enjoy also them being a child. Like, that is totally okay. But if you have any other questions, leave them in the comments below, or reach out to me on Instagram. I am adimeofot on Instagram, or on my website, www.adimeofot.com. Okay.